Okay, so we've already discussed psychoanalysis, we've already discussed client-centered therapy. Both of those, I think those are the only two that we've discussed so far. Both of those are an insight therapy. So, in other words, the patient, client, depending on which therapy you're talking about, is trying to gain insight into their behavior and why they are feeling the way that they are feeling and the symptoms that they are having. Behavior therapy is not concerned with any insight. It is simply concerned with the behavior that you are doing right now. The maladaptive behavior that you are engaging in is the behavior that needs to be changed. Once that behavior is changed, then everything is okay. We don't care about the past is in the past, you can't do anything about the past. The future hasn't happened, so why worry about the future? What we need to be concerned about is present day, the behaviors that we are engaging in. So, it doesn't matter why somebody became an alcoholic. We're not concerned about that. Doesn't matter if you're gonna, if you want to imbibe in alcohol 6 days, 7 days from now. What we need to do is stop the drinking of the alcohol today. We'll worry about tomorrow when tomorrow gets there. Okay, so that's the idea behind the behavior therapy. So they're going to use the classical or operant conditioning principles in order to get there. So, conditioned aversion. So a learned dislike or negative emotional response to a stimulus. So with that conditioned aversion, we are going to teach you to dislike something that you currently like. That is going to be the idea. We're going to teach you to dislike something that you currently like. We're going to put you through some sort of aversion therapy. Associate a strong aversion to an undesirable habit, like smoking, eating, drinking alcohol, or gambling. So the example there is rapid smoking. If you do rapid smoking properly, then the idea is that it will eventually make you sick, and then hopefully the nausea and the vomiting associated with the rapid smoking would make you want to give it up. That's the idea. Okay? So, where are my smokers? When you are smoking a cigarette, quote unquote, normally, how often do you take a drag on that cigarette? Once every how many seconds? So the idea with the rapid smoking is, and you have to do it under the guidance of a professional, because with rapid smoking, the idea is take a drag on that cigarette once every 6 to 8 seconds. So 5 times faster potentially. Okay? And oh, by the way, after you've done the first cigarette, you don't stop. After you've done the first cigarette, you just keep going. Okay? And you just keep going. That's the idea. You're going to keep doing that until you are vomiting. The idea, of course, would be then that as a result of vomiting from the rapid smoking, then you dislike the smoking and you're going to give it up. And again, the reason why you need to do this with a professional is because if somebody were to try to undertake this behavior on their own, guess what they're going to do when they feel nauseous? They're going to stop. Exactly. So that person will push you through that. Here's one, an electric shock. Give an electric shock to someone who is an alcoholic. That's a response contingent reinforcement, or response contingent behavior. I won't say reinforcement. Applied only when a certain response is made. So you hook them up to an electric shock machine, and every time they put the cup to their mouth, you're just going to give them an electric shock. It's not enough to cause any long-lasting damage, just enough to be a pain so that hopefully they make the association between doing the behavior and getting shocked. There is, so develop a conditioned aversion to drinking. Does it talk about, let me just have a look here. No, it doesn't. How many of you have heard of Antabuse? Antabuse is a medication that you can give to an alcoholic, and the idea, let's just assume that the the drug lasts for 24 hours. You take the drug, you take the medication, and if you consume alcohol within the next 24 hours, you will end up vomiting. The idea, again, being that you make the association between the vomiting and drinking alcohol, and then you want to stay away from the alcohol. Unfortunately, though, I suggest to you, most people will probably make the association between taking the antabuse and the vomiting, not so much the alcohol and the vomiting.